Hey mamas, welcome back to the Strong and Nourished Mama podcast. Today we are talking about a super common issue for postpartum moms, lower back and hip pain. Y'all know how it is. It is not fun when you hurt your back. It is not fun when the hips hurt. You've definitely felt this when you're pregnant and especially when you're postpartum. If you've been feeling stiff or achy or like your back gives out, I hear this often from my clients like, oh, my back gave out or my back's hurting. By the end of the day, or when you're picking up things and just doing activities around the house, this episode is for you. Your core and your pelvic floor took a huge load during pregnancy and, of course, labor and birth. When these muscles aren't working properly in your pelvic floor, that is going to impact other areas like your low back and your hips and the muscles within those areas. And they're going to have to start to compensate. And this is going to lead to pain, instability. And if you aren't aware that you're compensating, then this is going to lead to a further weak core, even more back pain, and even more hip pain. And not only in the first year postpartum, but this can even happen years, decades down the line. So I see moms who have little ones that are 7, or maybe their kids are in their 20s, 30s, and they're still experiencing low back pain and hip pain. And it can be related to a variety of things, of course, but pregnancy, birth, postpartum, a weak core, they have everything to do with it. So today I'm going to share why moms experience lower back and hip pain, 4 common mistakes that make it worse, and things you can start doing today to improve strength and stability and be pain-free. Grab a notebook and pen, let's get into it. Feeling exhausted, overwhelmed, and like you've lost yourself in the postpartum chaos, struggling to rebuild your strength, heal your core, and feel confident in your body again? Hey mama, I'm Val, a functional sports dietitian, postpartum fitness coach, and a mama who understands exactly what you're going through. Welcome to the Strong and Nourished Mama podcast, where I help busy moms like you regain your energy, rebuild strength, and feel amazing through simple, science-backed nutrition and fitness strategies. If you're ready to go from depleted to strong, nourished, and unstoppable, you're in the right place. Let's dive in. Here's the thing. I know you want to know exactly what you're getting before you commit to anything. So let me lay it out for you. When you join the Restore Your Core Bootcamp, here's what you're going to be getting. You're going to get a live interactive session where I walk you through exactly what's going on with your core and your pelvic floor postpartum. You're going to be learning practical, simple exercises to help you safely start rebuilding your strength. Nothing complicated, nothing crazy, no guesswork. Just a step-by-step plan so that you can finally know what exactly is safe to do and also what is effective for your body right where you are, whatever chapter you are in right now. You're going to be getting a workbook when you sign up. I'm going to send it a few weeks before the boot camp. We're going to work through that workbook, and we're also going to allow enough time for question and answers with me. So any big postpartum fitness questions that you have, bring them to the boot camp and I will answer them for you live. I'm also going to be sharing fun bonuses only to those who sign up. Now, that's not only to those who show up live. It is to those who sign up. So if you can't make it, if something comes up, I'm going to still be sending you the recording when you sign up along with the resources, and you are still going to get access to those fun bonuses. I will be walking you through the exact steps I did when I was postpartum, and it is going to be so helpful. I am now 18 months postpartum, and my core is stronger than it was before. I no longer have diastasis recti, and I am feeling awesome. This is your roadmap to feeling strong and confident again. And the best part, it is completely free. So if you've been wondering whether this is right for you, now is your chance to see exactly what's inside. Join me by grabbing your spot at wellnessbyval.com/bootcamp, and I can't wait to see you there. I was working with a client. She was pregnant at the time, had a 2-year-old toddler, and she was complaining of low back pain and tightness in the hips and achiness, not only just activities of daily living, things she was doing around the house, just picking up her toddler, but also in the gym when she was working out, or maybe if she was sitting for too long and then she went to the gym. So when we were looking at her tendencies, her posture, how she was activating and controlling that intra-abdominal pressure, come to find out is she was compensating because of her weak core. And her core was weak because, one, she's pregnant. She was still recovering from her first pregnancy. She's pregnant with her second pregnancy. And we have this increased pressure from baby. And then we have additional pressure when we're trying to hold our toddler, or we're trying to pick up the laundry basket, or deadlift or squat, any of the movements that we do in the gym. And so with that, if we have a weak core, it's easy to compensate and use other muscles, or even just hanging out on the spine. So for example, when you get tired of holding your toddler or you're walking your baby to sleep, you may start to notice that you thrust your hips forward a little bit and you kind of have that pancake butt, and you just hang out on the spine, and then later your low back starts to hurt. Or then when you do go in the gym, you start to notice some aches and some pains. And it goes back to that weak core muscles. And we're going to talk a little bit about that today. So once we focused on breathing techniques, which takes time and connection, we also worked on posture and bringing these together with her typical tendencies, and trying to make sure that when you are holding baby, let's try to keep the rib cage down and in, slight tuck in the tailbone. Let's try not to thrust our hips to the right or to the left to hold baby. Let's try to be in a really good position when we're holding our baby or holding our toddler. A good way to practice this is, of course, with your activities of daily living, so that it can easily transform when you are in the gym, any of the movements that you're doing. So once she focused on these things, posture, breathing techniques, she was able to strengthen her core so that she wasn't using her back or compensating using other muscles that she wasn't supposed to be using. And her back pain went away and her hip stiffness went away. How awesome is that? Today we're diving into why postpartum moms experience lower back and hip pain. And it can be when you're pregnant, it can be when you're early postpartum, but you can also experience this years after you have your baby, especially if we've never addressed it early on, and especially if there is a weak core. So some of the key causes that postpartum moms experience lower back and hip pain are, one, the weak deep core muscles. So that transverse abdominis, that corset muscle that wraps around the spine, is going to protect us, and it's going to help stabilize your spine. When we contract that and we can control this intra-abdominal pressure, then that's going to, and breathe and do all of the things that we're asking our body to do, that's going to be really helpful so that we don't start to feel low back pain or hip pain. So a big reason is that deep core muscle is not strong enough, and we have to start bringing connection to that. There may be some pelvic floor dysfunction, a weak or overly tight. Overly tight is very common, especially in women who are exercising. Overly tight pelvic floor can cause a misalignment in the hips and the lower back. We want to be able to contract our pelvic floor, but we also want to be able to relax it. And what I'm finding is most women are just over contracting. They're not able to fully relax, or they're never relaxing. We have this hypertonic pelvic floor. Other women may have a weak pelvic floor. So it's very difficult to activate that contraction, but really good to relax. So it could be opposite. And you may have a little bit of both. Some signs of a pelvic floor dysfunction include leaking, incontinence, heaviness in the pelvic floor area, difficulty engaging the core. There can also be postural changes and movement patterns that can affect our low back and hip pain. And common postpartum posture, as I've mentioned, is arching your back when you're holding your baby, or you're thrusting the hips forward. You're putting more pressure on the low back. Standing with weight shifted to one side, so you're having baby sit on one side of your hip. That's going to cause misalignment, and that's going to definitely lead to achingness and pain. And sitting with poor posture while breastfeeding. It's so easy to do this, to kind of hunch forward when we're feeding baby and kind of just hang out, because why not? We're feeding our baby. But this can lead to tightness of the hip flexors and can weaken the glutes, especially if we're just sitting for long periods of time. Because when we're sitting, we're going to be shortening those hip flexors. And when the hip flexors become tight and they attach to the low back, that's going to also pull on the low back. And so we want to be able to have strong hip flexors. We also want to make sure that they're dynamic, they're flexible, so they're not super, super tight. And then we want to give some love to the glutes. We want them to be nice and strong so that they can help stabilize the hips, especially when we're having to shift to one side for a minute, or we're doing lunges or single leg deadlifts, any movements in the gym. And then the last cause is lack of core bracing strategy. This is what we're going to really go over in the boot camp, and I'm super excited to practice this with you in the boot camp. Many moms don't engage their core properly during daily activities like lifting the car seat, carrying your toddler, laundry basket, bending over to empty the dishwasher, picking up toys off the floor, and then of course exercising. So if we aren't engaging our core properly doing those activities and we hurt ourselves, then that's definitely going to probably happen in the gym. So we want to make sure that our core bracing strategy is effective. We have to be able to breathe, activate the transverse abdominis, that deep core set muscle, breathe into our lats, our rib cage, maintain that intra-abdominal pressure, and then do those movements that we want to do so that we don't hurt our backs. Without core control, the lower back is going to absorb much of this strain. And when that happens, that's when you're really going to feel that pain, the achiness, the tightness, and it could lead to a really serious injury or an insult to the back. And we want to make sure that at all costs, we're protecting that low back. I also teach group fitness and a variety of different types of classes I've taught in the past. I'm currently teaching cycle, but even in my cycle class, I am teaching and coaching them to focus on their core, their bracing strategy. Even though we're sitting on the bike, we don't want to just hang out on the spine. We want to get our spine out of our hips. We want to sit in a really good position. And then that also is going to help us breathe, especially during a cycle class. So this is some things that I'm noticing moms, what's going on with moms and why we are experiencing low back and hip pain. Deep core set muscle is weak. We have some pelvic floor dysfunction, postural changes in movement patterns, and we have this lack of core bracing effectiveness. We're not able to actually effectively brace our core, breathe, and move at the same time. Now, what are some common mistakes that make this pain worse? One, jumping into crunches and sit-ups too soon. Too soon after having a baby, even if you're a year postpartum and we haven't focused on the basics, the foundations of healing your core, strengthening your core and your pelvic floor, if you're jumping into crunches and sit-ups too soon, more than likely you're going to see that doming effect in the center of your abdomen, coning, doming. That's not controlling intra-abdominal pressure adequately. We have diastasis recti, and so that linea alba and the rectus abdominis aren't back into the position that they need to be in. And so when we don't have much control in that intra-abdominal pressure, when you're doing a sit-up, then you're going to see that bulging come up. And so these exercises especially are going to put way too much strain and pressure on a weak core and pelvic floor. It's going to worsen your pain because we're not effectively going to be using those core muscles. And then again, we're going to be compensating. Number two, overstretching without strengthening. So stretching tight hip flexors, it feels really good. It feels really good. A lot of the times I see people, not just moms, but will be in a kneeling position with your back knee on the ground, your front leg is in a lunge position with your foot flat on the ground, and we hinge forward or thrust our hips forward to get that back hip flexor stretch, but we're not bracing our core, so you're kind of just hanging out on the spine. I see this a lot in yoga. Now, if you are controlling your glutes and your abs, it's like your glutes and your abs are fighting one another to be able to protect the low back, and you're controlling intra-abdominal pressure, and you're able to still get in that position, and you may have some extension in the back and the low back, then that's okay. But if we're just hanging out on the spine, it's called a banana back. It may feel good on your hip flexors temporarily, but you're going to, one, probably stay tight in those hip flexors, and two, hurt your low back even more. We want to make sure that we're controlling that pressure. The glutes and the abs are fighting one another, but we're also strengthening those two muscles. And we have to be able to use that brain-body connection, that neuromuscular connection. Number three is ignoring the pelvic floor. We cannot ignore our pelvic floor and our core. They're working together. So if we're only focusing on the abs, like crunches and sit-ups, like I gotta get my six-pack back, I have to lose this baby weight, but we're not focusing on the pelvic floor activation and full relaxation, then that's gonna lead to instability. And that may cause, I'm sneezing. Maybe your first sneeze, you don't pee, but your second, your third, they always come in pairs or threes, right? With your sneezes, and you're like, gosh dang it. And then you pee. And you pee a little and you're like, what the heck is happening? So we have to be able to work these two together. The core and the pelvic floor, they're one. We'll go into more detail with that in the boot camp. And then the last one, the fourth one, poor posture when carrying baby and doing daily tasks. I see this a lot. It's so easy to do. I've done it myself because I'm just like, I'm tired, but then I have to tell myself, okay, let's get back into a good position, or let me put you down. Let me do something else so that I can make sure I'm in a good neutral spine. I'm in its really good alignment so that I can engage the core when I'm lifting my baby, or when I'm bending over, I'm lifting heavy weight, I'm standing, I'm going from a seated position to a stand position. All of that is really important. And the more we think about it, the more we practice it, the better we become at these tendencies. Whatever we continuously practice is what we'll become. So practice doesn't make perfect, because if I'm constantly squatting, practicing in a bad position, so if I'm in the gym and I'm squatting, but my knees are caving in, I'm shifting weight forward, my back is hunched and flexed, and my heels are coming up off the ground, I'm doing a squat per se, but I'm practicing it in a bad position. But if I continuously practice it in that bad position without good form and core stability, then that's all my body's gonna know. So whatever we continuously practice, meaning the positions that we are always in, the tendencies, our posture, our breathing, whatever we're doing continuously in our everyday life, that's what our body is going to know. So it's going to take time to be able to think and tell our body, our brain, tell our muscles, okay, this is what we need to do. This is what we need to practice. And then the more you practice it, it becomes second nature, and it's awesome. So how are you going to strengthen your core and your pelvic floor to reduce low back pain and hip pain? One, we got to start with the basics. Start with diaphragmatic belly breathing. That's going to be helpful for learning to relax the pelvic floor. It's going to be really supportive for the nervous system. It's also going to help connect or reconnect the core and the pelvic floor together, because they're moving together on every inhale and every exhale. So you're going to lie on your back, or you can sit, you can stand, you can do this in any type of position. You're going to inhale as belly goes out, you're going to exhale as belly comes in, and you're going to leave the pelvic floor relaxed. Now, another breathing technique that we can do is we can activate that deep core, that transverse abdominis. So you can do some TVA activation. You can also pair that with some stability breathing. I'm going to go into more detail in this in the bootcamp for you to practice. And that's the type of breathing technique that you are going to use when you are holding baby, lifting things up from the ground, doing heavy lifting, or any type of lifting in the gym. Number 2, we have to do some gentle core and pelvic floor activation exercises. We don't want to rush into anything too quickly. We want to be able to make sure that we're listening to our body and what we're feeling and adjust as needed. And so that's why working with a coach is really, really helpful, so you can have that guidance. But some gentle core and pelvic floor activation exercises include a variety of different types of pelvic tilts. It could be as simple as cat-cow. You could actually do this on your back. And so you're tilting the pelvis forward and backward, anterior and pelvic tilt, to be able to work on that connection. And then you're also using your breath and your core at the same time. Glute bridges is really good because you're going to be strengthening the glutes and your core. You can add in a variety of different amplifications to that glute bridge to make it harder. So when you're early postpartum, it's just body weight. It's just learning to breathe, connect, and then go into the bridge, and then come down, take a breath, and then do it again. And then maybe we hold it a little longer. Maybe we do single legs. Maybe we add a band. Maybe we add weights. Maybe we do hip thrusts with heavy weight as we progress. Another great one that I love is dead bugs. Dead bugs are amazing. It's going to be really safe for core strengthening, something that you can do during pregnancy. And there's so many amplifications with a dead bug that I show my clients. We also want to make sure that we're strengthening our supporting muscles. So we're not only focusing on the breath, the core, and the pelvic floor. We want to start there, but we also need to make sure we're strengthening supporting muscles like our glutes, our quads, our hamstrings. Squats and lunges are a great place to start because this is going to add in some core stability and hip stability, hip alignment. And a great place to start is going to be body weight and then progressing from there. There's so many different variations of squats and lunges that's going to test your core and your hip stability. Another one that I love to help support those supporting muscles is going to be side lying clamshells. Now, we don't want to just lay on our side and do a clamshell and move. We actually have to think about that engagement. We have to work on the TVA activation, the stability breath, and then you move into that clamshell. That hip abduction, of course, where the leg is going away from the midline of the body. Adduction is where the leg is going to the midline of the body. You're adding it to the body. So of course you would want to do it on one side and then do it on the left. You want to be in a good position with the back, and you want to breathe while you're doing it, and then have the pelvic floor and the core working together. And then you can amplify this by adding bands. Really great to do during pregnancy, and then especially postpartum. And then eventually, like I'm still doing these as part of my warm up, and it's amazing. And then the last one, daily movement tips to reduce strain. Let's think about our activities of daily living, our tendencies, the postures that we are in every single day. Try to practice what you're learning, especially what you learn in the boot camp, engaging your core before lifting your baby and bending over. So that's what's really going to help you prevent that hip and that low back pain. Can you work on that stability breath, that engagement of the core before lifting up your babe? Use supportive chair for breastfeeding to avoid slouching, so making sure you're in a good position so that you have that good posture. And then adjust your standing posture. Hold your baby, your toddler, and look in the mirror to see how you're standing, if you're compensating. Are you in a good alignment with shoulders over hips and rib cage down and in, slight tuck in the tailbone? We want to make sure we're in a good position, stacking the ribs over the pelvis and engaging our core slightly. It's not like you're going to be in 100% engagement holding your toddler. It's just like maybe 20-25% engagement, just to make sure that you're not hurting yourself. And then avoid standing with the hips shifted to one side for too long. Now, if you do it for a little bit, that's fine. But if you're constantly just, okay, right hip out and then switch to the other side, then you're not going to be activating your core. You're going to be in a unsupported posture, and that's definitely going to lead to low back pain. It's going to be a lot easier to hurt your back and then have the hip pain as well. So let's recap. A weak core and pelvic floor is going to lead to increased back pain and hip pain. When strengthening these muscles, you're going to reduce pain and you're going to improve daily movement. It's going to be feeling really good because you're not going to have to worry about, oh my gosh, am I going to hurt my back if I pick up my little one? Am I going to pee my pants when I chase after them and then my hip's going to hurt? We don't have to worry about that. Remember that small, consistent efforts make a big difference. So you don't have to spend hours every single week practicing these different movements and these different techniques. You can simply start with 2 minutes a day. And you want to start with those foundations. So that's why I want you to join my Restore Your Core Bootcamp. It's happening on Wednesday, April 16th, 12 p.m. Mountain Time. Go to wellnessbyval.com/bootcamp to sign up. Get your spot today. I will be sending the workbook and the resources a couple weeks before the boot camp, and I'm so excited. It's going to be such a fun experience, and I can't wait to see you there. Hey mama, I hope you loved today's episode. If it resonated with you, would you please take 30 seconds to share it with another mom, a mom who's looking to make healthy eating and exercise easier, because we need that. And if you haven't yet, I would be so grateful if you could leave a quick review on Apple Podcasts. It truly means the world to me and helps the show reach more amazing moms like you. All right, time to chase my toddler around. Stay strong and nourished, and I will be back on Monday with another episode. Talk soon.